opposition.
Thank you, Speaker. My next question is also for the Acting Premier. The legacy of the Harris Conservative era isn't just firing nurses and comparing them to hula hoops. That government also opened the door for private for-profit health companies, inviting private home care providers to bid on home care contracts and approving Ontario's first private hospitals. Does the Acting Premier think that this legacy is worth repeating?
The Deputy Premier.
I don't think she knows our healthcare system.
Through you, Mr. Speaker, to the Leader of the Official Opposition, any suggestion with respect to privatization being the goal of this exercise is ludicrous. What we are doing is strengthening our public healthcare system, and it's going to be up to the providers who already provide care. It may be a hospital, it may be a home care provider and a mental health agency, for example, that may choose to come together to apply to become the local Ontario health team. If they are accepted under the strict criteria that we are putting together, they will then have fiscal responsibility to deliver care with all of the healthcare providers in their area. They will also be required to deliver the quality of care that will be expected and will be required to continue to exercise their responsibilities with patients at the centre of it all. It's all.
Thank you. Thank you. Supplementary.
Well, Speaker, I dare say that privatization is absolutely going to be a bonus for all those folks that paid $1,250 to go to a dinner last night for the Conservatives. Look, families in Ontario have lived through this before, unfortunately, Speaker, and they heard the same excuses that we are hearing today from both Liberal and Conservative governments. Meanwhile, they're living with the legacy of a broken home care system and paying the price for expensive P3 hospitals. What health services does the Acting Premier plan to privatize this time? Because we know it's coming.
Sure. Deputy Premier.
Thank you, Mr. Speaker. Again, through you, what I would say is being done by the Leader of the Official Opposition is fear-mongering without any basis, any basis whatsoever. We, for the 15th time, if I need to tell you, are strengthening our public health care system. That's what it's about, to centre it on the patient and to make sure.
Okay. Apologize. Opposition will come to order. I have to be able to hear the Deputy Premier's response. Deputy Premier, please conclude your response.
Thank you. We are taking steps to ensure that the patients of Ontario receive the coordinated care that they expect and deserve, that they are not receiving under the current system. That is what this transformation is all about within our public health care system. And I think just to read one more quote, and this is from Dr. Doris Grinspan, the CEO of the Registered Nurses Association of Ontario, who said that today's announcement marks the beginning of much.
Supplementary. Final supplementary.
Speaker, look, families across Ontario are looking for a public health system that gets them the care that they need without leaving them stranded in a hallway for hours. But what they're seeing is nurses that are still losing their jobs, Speaker. Hospital beds that are closing at this moment. Hospital beds that are closing. A health minister who can't or won't say how many more jobs are going to be lost, and the Conservatives of the Mike Harris era being handed six-figure paychecks as health advisors to this government. Does the Acting Premier think people will be fooled again?
Yeah. The government members must come to order. That wasn't appropriate at all. Start the clock. Deputy Premier, please respond.
Thank you, Mr. Speaker. I'm sorry, I did just want to read this one quote there because it has to do with nurses, and I think it's important, from Dr. Doris Grinspan, CEO of the Registered Nurses Association of Ontario, who said, I quote, "Today's announcement marks the beginning of much-needed change in the health system and the continued role registered nurses must play in both coordinating care with patients in their communities and in helping Ontarians navigate its complexities." End quotes. Dr. Grinspan and the RNAO support the changes we're
Member for
bringing
Waterloo,
forward.
come to order.
The
Member for King
OMA,
Vaughan, come to
Ontario
order.
Medical Association, supports these changes. The Home Care Ontario supports these changes. The Ontario Hospital Association,
Wow.
on and on it
Why
goes.
don't you guys
I don't understand why all of
Response.
these providers are so excited about the changes coming to our public health care system, while the official opposition just seemingly doesn't get it.